The research that we are doing is on a parasite called Toxoplasma gondii. It's a parasite that infects about a third of the world's population. But what happens is when you get infected, it's typically without symptoms. The immune system takes care of it, but this is where the insidious part of the parasite begins, where it forms these cysts that end up in the muscle and brain. Periodically, these parasites reactivate. If you're actually a patient who has HIV/AIDS or is immunosuppressed, who is undergoing chemotherapy for cancer, or a recipient of an organ transplant, for instance, if those reactivation events occur, you now have a life-threatening situation. So as a result, individuals who are infected with the parasite have to be on drugs just in case the parasite reactivates, and the drugs have very significant side effects. The modeling approaches that Dr. Patwardhan has developed with our inputs really will allow us to get a snapshot into being able to recognize, are there driving dominant patterns that would allow you to predict the cycles or the manner in which reactivation might occur. And if that is the case, maybe we can adjust treatment to have patients go on a drug holiday when the chance of them reactivating is really low. And so for about 35, 40 years, as far as I can remember, there was this notion that these were dormant and these were sitting there and they were not really doing much. The cyst itself, as a singular entity, has hundreds to thousands of parasites within it called bradyzoites. The trouble was we didn't have an accurate way to actually count them. So when we looked at cysts, we'd say this is one cyst and here's another one, but they could have 5 times different levels of parasites within them. So you were really comparing perhaps a grapefruit to a tangerine. So they're both citrus fruit, but very different in their size and scope.
So in passing, he said, hey, we are doing these things and there are these parasitic organisms which I had zero interest. And he said, we get these pathology slides, we purify these cysts, which didn't mean much to me at that time. And we count them manually. Is there something that your group can do to help us with that? We worked on a software that we tested. So something that a skilled technician, a motivated technician probably could have counted in about a week. This software that we developed allowed that individual to count the number of parasites with the same degree of accuracy in probably 4 to 5 minutes. That tool they liked. They even named it Brady Count 1. Proved to be very useful.
And what was amazing was that it immediately transformed our ability to capture accurately how many parasites were within a cyst, which immediately showed that there was a lot more diversity and a lot more heterogeneity and something else was afoot. And part of what this did was it led us to ask the very heretical question of, are these parasites actually dividing when they are viewed as being completely dormant?
So if they are not clearly sleeping, if I may use lay terms, then how awake are they? How much potential they have to cause mischief? The shape of the image within each cell informs him and his people about what state that particular parasite might be. And these are squiggles. Those wiggles strangely reminded me of a script that is used in southern part of India and Persian language people, because they look like that. So I said this problem from an engineering perspective is really no different than training a computer to recognize handwritten script, where somebody is a little bit sloppy in their writing, if you will, because the shapes are not always consistent, but there is a pattern to be seen.
So when we actually demonstrated that not only was this dormant form actively replicating, but it was doing so with a level of complexity that nobody appreciated, we effectively really rocked the field and turned things upside down. What I think is really most significant is when we apply those tools to the biology, we are going to see patterns that nobody 5 years ago had even predicted existed, in fact said could never exist, to now really be a few steps away from being able to apply it potentially in clinical practice, in testing new drugs, in driving how drug treatment happens in this particular instance. It opens up the biology, it opens up the technology, but it's at the convergence of the two where I think the magic is really going to happen.